Hi, everyone. I'm Dr. Glenn Corneil. I'm the Acting Medical Officer of Health for the Timiskaming Health Unit. We are very excited to now be able to offer the Pfizer vaccine to people who are 12 years and older, so the 12 to 17 age group. We wanted to provide an opportunity for students to ask questions and provide some answers. You will all be making your individual choice about getting vaccinated or not. And we just think it's really important that you're provided with facts and information so you can be comfortable with the decision that you make. And you're also making it based on facts and not being maybe swayed by myths or rumors that are out there. So what we've decided to do, I would much prefer to do this with you in person, but of course with COVID we can't. So I'm also a practicing family doctor in New Liskeard. So we're going to set up the format where it'll be like I'm in my office with a student who's asking me questions, and we'll provide some answers. And hopefully this is helpful for you. Thanks as well to those who submitted questions. We had over 80 questions submitted by students, which was great. We've put them into about 7 categories. So we're going to go through about 7 questions and answers today. So let's get started.
My name is Lily Graydon, and I'm a grade 11 student from TDSS. The vaccine was developed quickly. Is it safe for youth 12 to 17 years old?
Yeah, so hi Lily, thanks for taking part in this. It's really great to see you. I think I'll give a little bit of a longer answer with this one. So the way vaccines work is usually a live vaccine or a part of a vaccine is injected, and then our body produces antibodies, which is our immune response, so that if we're ever faced with the virus, our body is ready to fight it off. What's really exciting about the Pfizer or the mRNA vaccines is while it's new technology, it was actually technology that had been studied for about 20 years or so. And the way these vaccines work is with the injection, our body it kind of tells our body how to make what's called a spike protein, which is part of the COVID-19 virus. Our body then produces antibodies against the spike protein so that when we're faced with COVID, away our body goes and we can fight it off. So it's really quite neat and effective and a safe technology. And then what happened with COVID-19 and the pandemic is we needed these vaccines as soon as possible because it's the number one thing that's going to get us out of this. And so the whole world's vaccine community worked together, and all of the steps for vaccine approval took place. But they took place around the same time. So usually what happens is phase 1, phase 2 happens, then phase 3 and phase 4. What happened is the countries worked together. So as phase 1 was going on, phase 2 was happening at the same time, phase 3, phase 4. So that's how it was done really quickly, is there were no shortcuts. All of the steps were taken. These vaccines have been approved like every other vaccine that we've had in Canada. And the phases happened at the same time. The other thing to remember is you and your age group have also had new vaccines already. So in your lifetime, the chickenpox vaccine was new. The Gardasil vaccine was new. So we've got a lot of experience with vaccines. They've been around for over 100 years. And so then what was exciting is the Pfizer company and the mRNA companies, as they found that it was safe and effective in adults, the studies were ongoing and they're now complete for the 12 to 16 age group and the pre-existing 16 plus age group. So safe and effective. And now the studies are underway for the less than 12 age group as well. So yeah, good start.
What are the short-term and long-term side effects?
Yeah, very, very common question. For those of you who've had the vaccine already, the most common thing is no short-term side effects. A lot of people, the most common side effect is some soreness in the arm muscle where you get the vaccine. That's the most common one. We're also seeing, because that's where the reaction is starting to take place. We're also seeing for the first 24, 48 hours that sometimes not only is sore muscle, sometimes people can feel a little bit achy in other muscles. Sometimes they can have a headache. Sometimes they can feel tired, but those usually all go away after the first 2 days. With respect to long-term side effects, we haven't seen any yet at all. So in the US, about 3 million youth have been vaccinated. We've not seen any long-term, again, this is all new, but no long-term side effects have shown any sign at all. We also know that vaccination is extremely safe. So it's something Canada and the world is watching extremely carefully, but so far so good.
How effective is the vaccine?
Yeah, so far the vaccines are performing extremely well. With respect to the mRNA vaccines, the studies showed that they were effective in about 86% of people. Since we've brought them to market, what we're seeing is they're performing at that level or even better. The big thing we're seeing with vaccination is that people who've been vaccinated aren't getting that really sick, critical level of sickness that are needing to be admitted to ICUs or dying. And we can see that already. So the first group that we vaccinated were those living in long-term care homes. And already we've seen a big drop in outbreaks in long-term care homes. We're seeing a lot of protection being provided for those who've been vaccinated. We know from the vaccines that the first dose works, but we really need that second dose, that booster, to give us that really long-term immunity. But like we see with other vaccines, even though we've been vaccinated, some people can still have a mild infection with COVID. They can still be contagious, but those really serious, concerning effects of infection have really dropped off, and we're seeing even, vaccine after vaccination, we're just seeing a big drop in numbers, especially once people get their booster. So it's going extremely well.
Will the vaccine change my genetics or cause infertility?
Yeah, and you know what? It's really natural to ask these questions. There's certainly, I think, because these are mRNA vaccines, mRNA is related to DNA, so it's natural to wonder if these things can happen. So first of all, the way the mRNA after injection, it's broken down very quickly by our body once we get the injection. So there's absolutely no way that the mRNA can somehow affect our RNA or our DNA. So there's no chance that that can happen. So similarly, with respect to fertility, this has been looked at, and these sort of things are taken very seriously. There's absolutely no evidence at all that fertility can be affected by mRNA vaccines. So there was a theory that was out there. It's been explored, zero evidence. There's just no similarity between the vaccine and things that can impact a woman's ovaries, sperm, or fertility or DNA.
Will it affect my menstrual cycle or affect birth control?
Yeah, so absolutely no effect on birth control. There's no interaction between these vaccines and other medications, things like that. We're hearing a little bit about women noticing some period change, but again, there's no evidence of this at all. In this age group, so in the 12 to 17 age group, women have often have irregular periods or menstrual cycles anyway. We also know that stress can make menstrual cycles be irregular. But again, because the vaccines cannot affect ovaries, they cannot affect ovulation, there's been absolutely no evidence that the menstrual cycle is affected. So yeah, so far so good on that one for sure.
Do I really need the COVID-19 vaccine?
Yeah, big yes. So vaccination is absolutely what's going to get us out of this and get us to get back to normal. We hear a lot of people who are hesitant say, well, if everybody else gets it, then I'm not going to need to get it. And we know that's not true. So in kids that are, in the youth that are in 12 to 17, what we've seen from the studies is they respond extremely well to the vaccine, that their body produces a really robust immunity to it. But we also know from adults and others that we're studying is some people who get vaccinated, they can still get COVID. Again, sometimes they don't even know it. Sometimes it's really mild. And we also know that in our grandparents and in the elderly, sometimes they don't have as great an immune response to the vaccine. So even though they've been vaccinated, they can still be vulnerable. So there's 3 reasons, big reasons why you need to be vaccinated. Everybody needs to be vaccinated. 1, to protect yourself. 2, to protect your families and your loved ones. And 3, we really need to get the COVID virus out of our communities and under control. So just going back to the chickenpox vaccine. So 20 years ago, all of the kids pretty well got chickenpox. And so they developed a chickenpox vaccine, and 90% of you have gotten vaccinated for chickenpox. And we hardly ever see chickenpox now. If we do see it, it's either in somebody who didn't get vaccinated, or it's in a really mild case in somebody who did get vaccinated. And that's exactly what we need to have happen to the COVID virus. If we only have 50, 60, 70% of people vaccinated, there's going to be a lot of COVID virus still kicking around in our communities. So we really need everybody to step forward and get vaccinated. It's what's going to get the virus levels down to a really low level, and it's what's going to allow the province to start opening different things so we can start getting back to normal.
When can we get back to living normally and hanging out with friends?
Yeah, so segue, it's absolutely vaccination. So the province has already announced that once we get a certain level vaccinated, once we get second doses, they can start to reopen. But if people aren't stepping up to get vaccinated, and we're going to still see a lot of COVID-19 activity in the fall, then it's going to be really hard for the province to open up schools, to open up social gatherings, to open up dance classes and hockey teams and chess clubs and things like that. So we really need everybody to get vaccinated. The vaccine rates are going to be what the province is going to determine, but then how much COVID we're seeing in our communities is really going to be important as well. So we're really hopeful for the fall. Timiskaming Health Unit's working really hard to get everybody not only their first dose, but also their second dose by the end of August before school starts. So it's going to be up to the individuals to make their informed choice to step forward and get vaccinated. And that's what's going to make the difference. I think that was the last question. So thanks. That was great. Really hope that this is helpful. There's a lot of misinformation out there. There are a lot of myths. We really want people to make an informed decision. But make their decision based on the facts and the safety, and be reassured that this vaccination program is going extremely well, and these vaccines are extremely safe and effective. So if people have more questions, we have sent resources out to the school. You can certainly call Timiskaming Health Unit, timiskaminghu.com. Our website has a lot of information. Talk to a trusted person in the medical field. They can answer your questions as well. So yeah, we really enjoyed being here with people today. Hopefully people will look at the video and share it with their friends, and hopefully this will help people get their question answered. So thanks very much, Lily.
Thank you.
Take care.